Welcome to Resume Storyteller with Virginia Franco, bringing you interviews with industry experts and regular folks who tested the job search waters and succeeded, and strategies to tell your story and land you job interviews in 60 days, guaranteed. Here's your host, Virginia Franco.
Hello, I am so excited to introduce my next guest, Casey Cronin. Today he is a clinical account executive with Nanthealth. He sells a unique molecular test that provides oncologists with critical patient profile information that's instrumental in the battle to fight cancer. But prior to joining them in 2015, he held senior sales roles with diagnostic lab companies, Solstas Lab, Partners NMD Lab. And then prior to that, he worked in specialty pharma and worked for companies including Kerr Health and Boehringer-Ingelheim. He began his career, however, in eyewear sales, which proves in my mind that with the right strategy, career pivots across industries are indeed possible. So, Casey, thank you so much for joining us. I appreciate it.
Hey, thanks for having me, Virginia.
So why don't you, I did a brief intro, but in your own words, can you give me a quick overview of your career history for listeners out there?
Sure. It's kind of actually sort of funny story. Growing up, I grew up and I'm dating myself here, but grew up during the era of LA law, and my mom was a paralegal.
You and me both.
And I was really sort of enamored by that lifestyle and had always sort of thought of myself as becoming an attorney and had prepped myself through school to do that. And when I graduated college, I went to work for the law firm where my mom worked for about a year just to get an idea of what being an attorney was really like. And before I went back and spent the money and the time to go to law school to see if it was something I would really enjoy. And also at the time, it was a recession in the economy. And when there's a recession, the applications for graduate school, law school go through the roof, and it became more difficult to get in. And so I just wanted to make sure it was something I really wanted to do. And in doing that, decided that was not what I wanted to do. And here I was, a college graduate, and it was like, oh no, now what am I going to do? And so, naturally thought, well, I can talk, and that's why I wanted to be a lawyer. So I thought, well, maybe I can go into sales. And I looked around for a while for a sales job, and through networking, someone my mom knew was looking for a sales rep in the eyewear industry. And I thought, well, that sounds interesting. So I went in the interview process and actually did not get the job the first time, but was called back sometime after that and was offered a job in eyewear sales. And I did that for a number of years and traveled around, and I was young and I was having a lot of fun, but I wasn't making a ton of money. And at the time, I really didn't care. But as I started to get older, I thought, well, gee, I need probably more income, and I need some health insurance and retirement benefits. And I thought, how am I going to do that? And so then I was able to get into pharmaceutical sales. I sold HIV medications for Boehringer for about 12 years or so, and then went into specialty pharmacy. I was sort of looking to make a career change at that point. That was sort of an inflection point for me. Got into specialty pharmacy sales. And then from there, got into, at the time, my hope was to get into more like managed care and pharmaceuticals. And then I got into diagnostics, started to see where the trends were going in the medical field. And now currently that led me to the position I have now, which is in oncology diagnostics. Okay. So that's the brief overview of sort of where I've been.
So the first career change was, what can I do that uses my ability to gab? And then the second one was, I need some money and benefits. But then it sounds like the third one was, what's going on with the economy, where the trend, to make a strategic shift based on that.
Exactly. And that's really well put. So, I've sort of tried to keep my eye on the industry trends and play to my strengths and sort of see where I want to go in my career, and made a plan to do that. So
you've done this now several times. Are there a couple of steps that you take sort of time and time again in order to make that pivot to a new industry?
There are a couple of things that I say that I've done. One of the things is to sort of always keep in mind where you want to end up. You kind of know where you want to be before you can start down the path to get there. And so just visualizing for yourself, what it is you want to do, and sort of visualize yourself being in that role constantly, and it sort of helps you get there. And then I think one of the other key things is to see what you're doing now that could relate to where you want to get to. What I mean by that is, when I was selling eyewear, I was calling on optometrists and ophthalmologists. And those are doctors. And so when I wanted to get into pharmaceutical sales, when I was in the interview process, I said, I'm already calling on doctors and I'm selling a technical product. There's really nothing different. It's just a different product that I'd be selling and a different set of doctors, but it's the same skills. And they bought into that. So that was really, I think, one of the key things is to look at what skills you have in your current position and how do those skills translate to if you want to make a change into that other role you want to take on.
So it sounds like you were able to, make them want to take the risk by communicating transferable skills. Did you ever apply online to different jobs, or was it strictly through networking and conversation you were able to sort of get these in for these interviews?
Well, it's funny. It's sort of a combination of those things, and I'm sure you're well aware that over the years, the way you apply for jobs and the way you get jobs has changed dramatically. There's been times when I applied just incessantly online, and that did yield some results at the time, and that sort of faded in popularity. Then it became more about networking and who you know. So it was really dependent on what was the popular way of applying at the time.
Yeah, and I think that the more senior you are, the greater your chances are of having success through networking. And to me, you're always going to give a better chance of someone taking a risk in person than asking a software or a computer who's going to look at your resume and take a risk, because computers aren't trained to take risks and say, okay, these skills are transferable.
Absolutely. I agree.
So I think those conversations, Yeah,
and as you said, as you get more experience, you've met people along your journey. And so, the old adage, never burn bridges. I think it's important to make very close relationships in your work life and to keep those relationships even after you leave and stay in contact with those people. That's how I landed where I am now. I never sold oncology diagnostics before. I just happened to call a friend of mine that I worked when I was in a full-service reference lab. He was the rep out of Raleigh. I was the rep in Charlotte. We became good friends. I just happened to call him on the phone one day and say, I'm sort of not happy where I am. I'm looking. Do you know of anything? And he said, hey, the company I'm with is hiring, and I'll put in a word for you. And that's how I got the job I have today.
Wow. Okay. And maybe it's not this most recent transition, but was there a challenge that sort of comes to mind when you were trying to go from eyewear to pharmacy or to pharma to diagnostics to oncology?
There were. And again, I always sort of knew where I wanted to go. Once I got into HIV medication sales, there was something about that clicked, and actually a couple things. One of them was I found that I really loved a very technical, complex product. I really enjoyed the learning process, and I just really kind of grasped that, striving for knowledge. The other thing was I really enjoyed helping people. There was nothing more satisfying in that role that someone who had HIV would come to me and say, hey, your medication saved my life, and there was no greater feeling.
Yeah,
so those two
that was a Boehringer, right?
Yeah, that was a Boehringer. Mm-hmm.
Okay. And what challenge did you face in terms of making that change from Boehringer to diagnostics? How did you make that happen?
Yeah, it took a while for me, meandering a little bit. Originally, when I left the eye, I thought more about staying in pharmaceuticals, but more in a different role, like managed care. And that's why I took a specialty pharmacy job. So I started applying to specialty pharmacy to learn about benefits and those kinds of things, trying to make that transition into managed care sales and doing something a little different within pharma. And then I started to see, again, there was a little bit of a shift in the industry. And I started to look at where things were going. And at the time, I realized that at least in medical sales, that the two biggest long-term growth areas that would have job stability and growth opportunities were in oncology and Alzheimer's/Parkinson's neurology sales.
Oh,
And I still believe that.
Okay.
So again, the challenge was at that time I realized that that's where the long-term opportunities were going to be. And so I sort of shifted from that time away from trying to get into managed care to learn more about diagnostics and genetics and genomics and as being the wave of the future. And I just worked to do whatever I could to get that experience under my belt so that I could transition.
And what did you do to really nail down, these are the areas with the biggest chance for growth? Was it just through knowing people? Were you reading up on oncology and neurology disease states, or?
Yeah, absolutely. So just reading up on articles and things I would see, trade publications, LinkedIn, the news, just a lot of different sources led me to that realization, but always kind of keeping my finger on the pulse of what was happening in medical sales in general.
Okay. So how do you structure your job search in terms, maybe it's a daily process, weekly, monthly, Or maybe it's how do you keep tabs on all your networks to make sure that you're keeping those connections?
Yeah, so, like I say, I've developed some friends over the years, and I always try to keep in contact with them with just an occasional phone call or an email. And I think part of it is, how desperate are you for a new job? If you have a job, you can take a little more time and be a little more selective. If you're out of work and you really need to find work, you have to be much more aggressive. And so it's sort of dependent on the situation. If I was out of work, I spent just all day, every day, calling people, applying online, looking for opportunities as much as I could. When I wasn't happy in a role that I was in and was looking to make a change, I did it more slowly and more selectively, but always with that end result in mind. I'm looking to get out, so I need to devote at least some time this week or today looking for what I want to make the transition to.
And were you just open saying to people, have you heard anything? People receptive to that, or did you approach it differently?
No, I did, exactly. Most of the people that I contacted were friends of mine, so I didn't have to worry about them calling my boss or anything and keep it confidential, but just say, hey, I'm really not happy where I'm at. If you hear of something or if you know of something, can you let me know? And that's yielded really good results.
Okay. So is there anything that sort of surprised you the most along this journey to across the different industries?
I think what really surprised me the most is the fact that I was able to make those transitions when I didn't really have the background for it necessarily, but just like I mentioned before, trying to take whatever skills I had and successes that I'd had in the past and transfer those to a new position. And that's sort of been a little surprising, but also it just goes to show the folks that listen to the podcast, you don't have to be stuck where you are. There is opportunity to make a change.
Yeah, that is so many people struggle with that and sort of making the case for how it's transferable. Is it a matter of, pitching the case to as many people and then at some point, all you need is one bite, one person to say, yeah, I'll give you a shot?
Absolutely. That is the key. But I also think the key is really having a very clear picture in your mind of where you want to be. If you don't know where you're going to go, you're never going to be able to get there.
Yeah,
and
that's a really good point.
Say just, I want to change. Well, that doesn't really mean anything. You have to say, I want to change and I want to do this, or I want to make a change and I want to do that, and strive towards that goal.
Okay. So and maybe you just answered the question, is there any piece of advice that you would give someone looking to make a jump, into any industry?
That would be, I think, my biggest piece of advice is to really clearly within yourself know what it is you want to do. And even within that, it could be broad, but know what it is you want to do and start to focus on getting there. And it may surprise you. It may lead you places that you didn't think that you necessarily would go within the realm of what you wanted to do, but maybe a slight tweak to it, and you might find happiness there.
Now, in terms of your industry, because, I work with people that, they say, well, I want to jump into medical device and I want to work for Medtronic, one of the biggest. And that's a really tough jump to go to a top company. What's your take on that? If that sort of a jump is realistic, or does it make sense to start with a lesser known company and then moving your way up to the biggest, the biggest leader in whatever industry you're targeting?
Yeah, I think really depends a lot on each individual situation and level of experience. But, my advice would be go both. I mean, if it's going to take going to a smaller company for a few years to get to that end goal, in the span of a career, a couple of years is not that long, and it gets you that experience. But I certainly wouldn't say, well, I'm not going to continue to try to get to that bigger company. In your example, Medtronic, I would still be applying, connecting with people on LinkedIn, sending them messages, attending industry conferences that are local in your area that you can go walk around for a day and maybe drop by a booth and pick up a business card or start a conversation with somebody. Okay. And so I think you really have to go after both.
Yeah, no, I think you're right. And you could take incremental steps while still having a strategy that keeps that end goal in mind.
Exactly.
Okay. Did you ever have to take a little step backwards in order to make the pivot, or were you lucky in terms of maybe taking a little bit of a pay cut to get into where you wanted to go?
Oh, of course.
You did?
Many times along the way, yeah.
Right.
Yeah, I did. I think one of the most notable ones was before I got this job, I was in full service diagnostics, and there was some genetic and genomic testing we did on a small scale there, and I was learning a little bit more about it. And I knew I wanted to make the jump, and I got an opportunity to go and sell toxicology, urine testing, but also there was a pharmacogenetic component to that.
Okay.
Those are the two tests they did. I took a huge step back in pay. I was an independent contractor, didn't make a ton of money. I did it for about 18 months or so, 2 years, and then that's when I landed this job, and I hope this is where I end my career.
Okay. All right. To me, that's a perfect example of sort of, instead of doing a big career leap, you did sort of a pivot. You jumped into something that was slightly what you'd done before with a little bit of what you wanted to do next, and then use that to get the next role.
Exactly. I did not want to sell toxicology, but I
You want to sell your example?
Yeah, I didn't. I really didn't want to sell that, but I knew that pharmacogenetic part of it would give me that piece of experience I needed to make that next leap, that next step.
Okay. So what is next for you then? I mean, you're in this company talk about, I know you were saying how doing something that makes such a difference in people's lives is so important, and this company certainly is with their product. Tell me, what do you see next?
What I really see, we're a relatively small sales force, and we're going to grow tremendously over the years. I think the next step for me is probably going to be a management role here.
Okay.
Talked about that, and I think as we expand this year and next, that probably would be the next step for me.
All right. Oh, that's exciting. So my favorite fun question is, to close things out, what is something that you think might surprise people about you?
And, I've given that some thought, and I think really this really translates well into the subject of the podcast. I was a history, political science major in college, and I'm now currently selling whole genome sequencing and transcriptome proteomics, all that very technical stuff for oncology with a poli-sci.
So without chemistry, without bio, without any of that coursework ever.
Correct. Now, that's not to say that I don't have to learn those things on my own.
Sure.
Now, and over the years, same thing with HIV, I read all the time. With oncology, I read all the time. I look at articles all the time. And so you have to keep up on that. But you're not defined by your major in college or what you did in the past. You still can do things over the course of your career, because it's a 40-year career. It's a long time, and experience typically always trumps book learning. So I think people would find that surprising. When I tell people that on sales calls, hey, I'm a history poli-sci major, they're like, wow, you really know your stuff. And it's like, yeah, but I didn't always, so.
Yeah, well, and I love the idea of it is a long road, and what you did 40 years ago shouldn't define your next step, as long as you keep that end goal in mind. And your end goal changed, right?
Yes, it did.
Each time.
It did. It changed with the times, but I knew I wanted to be somewhere that was going to have. Now, when I got to oncology, that was sort of where I thought that I would be to my retirement years. And so I wanted to look for something that wouldn't change so much or be outdated.
Right.
One of the things they say, Virginia, just a parting thought, one of the things they say is that, about there's going to be a number of jobs that in 15 years won't be around anymore.
I know.
So you always have to be flexible. Yeah. And so that's why you always have to be flexible, but always kind of have an end goal. If things in your life change, you have to make a new end goal and work to get there. Yeah,
I actually just saw a list of jobs that in 2 years, or it was a forward-leaning study, and it looked at jobs that will be the hottest, and like 50% of them did not exist at all, even a decade before.
Yeah, one in my industry is genetic counseling. There's a huge need for genetic counselors today, or there will be in the future. So people that listen, if that's something you're looking to do, that's going to be a great place to be for many years to come. Yeah, and you're right. And so you need to keep your dream fluid, because things do change, and the skills that you need are a lot of times you have them, but you have to learn the subject, but the skills stay intact and what's transferable. And you've shown that. Yeah, I agree. So, gosh, well, thank you so much. What a pleasure. I think you're going to give some hope to people that really want to make the change, but just don't know where to get started. So thank you again. Well, I appreciate you for having me. And as always, I look forward to talking to you in the future. That sounds good. Thanks so much. All right, take care.
You've been listening to Resume Storyteller with Virginia Franco. To learn more about storytelling strategies to catch the eye of today's SCIM online readers, hiring and decision makers, go to www.virginiafrancoresumes.com.